Hello, I'm Don Ellison, Benefits Coordinator with the Human Resources Department. Welcome to the 2010 City of Austin Enrollment Video on Demand. Open enrollment starts October 18th and runs through November 19th, 2010. All changes will be effective January 1st, 2011. The first benefits deduction will be January 21st, 2011. To make changes to your benefits, you will need to participate in open enrollment. This year, you'll no longer receive an open enrollment packet, but will receive the Employee Benefits Guide. The Employee Benefit Guides and coverage information statements have been delivered to the departments. If you did not receive yours, please check with your enrollment coordinator. Benefits information also can be found online at our website, www.cityofAustin.org/benefits/enrollment, or on the Internet CitySpace site under Employee Benefits and Services. If you are satisfied with your current elections and don't wish to make any changes, you don't have to participate in open enrollment. All your current elections will automatically roll over for 2011. Employees can now access the online enrollment system using their employee ID number located on their timesheet or the 2010 coverage information statements along with the first 5 digits of their Social Security number. You should have received the Employee Benefits Guide along with your coverage information statement. Take a moment to look at the statement as it lists all the dependents we have on file, and we've also provided the rates for 2011. If you find that we have listed an incorrect Social Security number or birthday for any of your dependents, you will need to make these corrections by participating in open enrollment at www.coaopenenrollment.com or the telephone system at 493-1350. During open enrollment, as you think of your benefits, we want to encourage you to update your beneficiary designation form. This form can be updated anytime during the year. If you are hired after September 10, 2010, you will not receive a coverage information statement, so you will need to complete a benefits enrollment form to participate in open enrollment. If you want to change your coverage for the remainder of 2010, you must come to the Employee Benefits Office. These changes would be adding or dropping a dependent, loss of coverage, birth of a child. At that time, we would assist you with open enrollment. There are several ways to participate. The online enrollment system will be open from October 18th through midnight, November 21st. The telephone enrollment system will be open 8 to 5 Monday through Friday through November 12th. It will be closed on Veterans Day, November 11th. Benefits enrollment forms will be available at your department. Once you participate in open enrollment, you will be mailed a confirmation statement within 48 hours. You should review your elections, and if there are any errors, you should go back and participate in open enrollment again. If you do not receive a confirmation statement, assume your elections were not accepted. Therefore, you will need to participate in open enrollment again. Benefits changes for 2011. There are a number of benefits changes for 2011. Flextra. The Healthcare Reform Act has mandated changes that affect the city's Flextra healthcare account. If you participate in this account, you should be aware of changes with regard to eligible expenses, and you should adjust the amount you choose to have deducted from your pay accordingly. Beginning January 1, 2011, to claim any over-the-counter drugs as eligible expense, you will need to obtain a prescription from your doctor, pay for the medication, and file a paper claim with ERISA Administrative Services. You will not be able to use your Flextra Healthcare Benefits card. In addition, any claims for over-the-counter drugs you incur in 2011 that you would like to apply to your 2010 account also will require a doctor's prescription. Medical plan. Later in the program, the representative from United Healthcare will review changes to the PPO and HMO medical plans for 2011. Vision plan. The new vendor will be Davis Vision. You will have an opportunity to meet a representative from Davis Vision later in the program. Short-term and long-term disability. Short-term will have no plan design changes for 2011. For long-term disability, employees will see a rate decrease for 2011. Life insurance. Employees will see a small rate increase for supplemental life insurance, 1 cent per pay period for every $1,000 of coverage.
Hello, my name is Laurie Messina, and it's my pleasure to be here today to give you an update on your United Healthcare benefit. We're very glad to be back working with the City of Austin again this year. 2011 will mark our 8th year in providing medical benefits for the City of Austin. We'll be giving a brief overview of the medical plan offerings and plan changes for 2011. Since our time is limited today, we'll only be highlighting the key areas of the plans. More details on the two plans are available in your Employee Benefits Guide. Let's start with an overview of the PPO plan and the 2011 changes to that plan. Increase in-network deductible from $300 to $500. Increase out-of-network deductible from $900 to $1,500. Increase in-network out-of-pocket maximum from $2,500 to $3,000. Increase out-of-network out-of-pocket maximum from $10,000 to $12,000. Increase prescription copays from $10, $25, and $45 to $10, $30, and $50. Change the way the out-of-network charges are reimbursed, which may result in increased out-of-pocket for employees who get out-of-network services. Now let's run through a quick overview of the 2011 PPO in-network plan benefits. Doctors in-network, primary care $20 copay, specialist is a $35 copay, minor lab and x-ray and preventive services covered at 100% no copay. The calendar year deductible for individual is $500 paid once per calendar year. The family is 3 times the individual deductible. Maximum out-of-pocket, individual is $3,000. Allergies covered at 100% after the office visit copay. Inpatient hospital covered at 85%. You would need to meet your $500 deductible, and then you would pay 15% up to $3,000. The plan pays 100% for the remainder of the calendar year. Outpatient surgery, $75 facility copay. Major diagnostic, $100 copay. MRI, CT, and PET scans, emergency room services, $100 copay per visit. Urgent care services, $35 copay. Acupuncture is covered under the PPO plan. Prescription drugs, Tier 1 retail is a $10 copay. Tier 2 is a $30 copay. Tier 3 is a $50 copay. Mail order is 90-day supply covered at only 2 times the retail copay. With the PPO, you also have out-of-network benefits. Please refer to your Employee Benefits Guide for the specifics of this coverage.
United Healthcare offers coverage for both the PPO and HMO plans. However, the city has established residency requirements for the HMO. Employees must live or work or receive benefits in the HMO service area, which covers Bastrop, Blanco, Burnett, Caldwell, Hayes, Travis, and Williamson counties.
Now let's look at an overview of the HMO plan and the 2011 changes to that plan. Increase outpatient surgery copay from $300 to $600. Increase hospital copay from $600 to $1,000. Increase out-of-pocket maximum from $2,500 to $3,500. Increase prescription copays from $10, $25, $45 to $10, $35, $55. Now let's run through a quick overview of the 2011 HMO plan benefits. HMO does not offer out-of-network benefits. You must seek services within the network for benefits. Doctors in-network only, primary care copay is $20. Specialist is $45 copay. Minor lab and x-ray and preventive services covered at 100% no copay. Calendar year deductible, individual and family not applicable. Maximum out-of-pocket, individuals $3,500, family is $7,000. Allergies covered at 50%. Inpatient hospital is covered at $1,000 per confinement. Outpatient surgery is a $600 facility copay. Major diagnostic, $100 copay for MRI, CT, and PET scans. Emergency room services, $150 copay per visit. Urgent care services, $45 copay. Prescription drugs, Tier 1 is a $10 copay, Tier 2 a $35 copay, Tier 3 a $55 copay. Mail order for a 90-day supply. No copay savings under the HMO mail order. It's 3 times the retail copay. Other plan changes that apply to both plans: implement mandatory specialty pharmacy program, requires employees to use mail order for specialty drugs at a single copay for 30-day supply. Enhanced preventive benefit. Examples of services that will be covered at 100% in 2011 are mammograms, colonoscopies, immunizations, well woman exams, well child exams, vision exams for children under the age of 5. Other items that pertain to the PPO and HMO: urgent care flyers are available on the City Space website or by attending an open enrollment presentation. All employees will receive new ID cards due to the change in the prescription copays. The vision benefits that have been available through the medical plans are still in place with no changes. These plans include an exam benefit and a material discount available through the UHC vision plan. For more details on these plans, please see the side-by-side comparison of these two benefits in your Employee Benefits Guide to determine the best utilization of the vision program for you and your family. Thank you.
Hello, my name is Melissa Jones, and it's my pleasure to be here today to review your vision benefits. Davis Vision is pleased to partner with the City of Austin to offer you and your family a comprehensive vision plan. The new vision plan provides you and your dependents coverage for an annual eye exam and materials. Davis Vision has a large network that consists of optometrists, ophthalmologists, as well as retail optical chains like EyeMasters, Walmart, and Sam's Club. To maximize the Davis Vision Plan benefits, we urge you to use one of the many in-network providers in the area. To find a provider, please go to our website at www.davisvision.com or call customer service at 1-888-445-2290. Routine eye exams are very important and can detect a variety of medical conditions such as diabetes, high blood pressure, and glaucoma. Your vision plan will cover a comprehensive dilated eye examination each calendar year for only a $10 copay. The plan also covers either eyeglasses or contact lenses each calendar year. For eyeglasses, you have the choice of choosing from the Davis Vision Designer collection of frames at no cost to you. The Davis Vision collection of frames is available at independent participating providers, or Davis Vision will apply $125 towards the retail cost of a non-collection frame that the provider is selling. Just as a note, the Davis Vision retail providers such as EyeMasters, Walmart, and Sam's Club do not carry the Davis Vision collection of frames, so you can select from any frame from these locations and get $125 applied to the retail cost, 20% discount off any amount exceeding $125. For the lenses in your glasses, the vision plan covers the standard lenses such as single vision and line multifocal lenses in full after a $25 copayment. In addition, your plan covers scratch coating and polycarbonate lenses for dependents up to age 19 at no additional cost. Davis Vision prides itself on having the lowest member out-of-pocket expenses in the industry. Lens options are not usually covered by most vision plans and would be an additional cost to the member. Davis Vision's in-network providers have a fixed, set prices on all lens options, which are printed on all member materials, so there are no surprises when you check out at the optical store. Examples of these lens options would be UV coating, tints, progressive lenses, etc. Additional discounts not available at Walmart and Sam's Club locations. If you are a contact lens wearer, Davis Vision's collection of contacts are covered in full after $25 copay. This benefit also includes the fitting and follow-up care. If your doctor prescribes contacts that are not in the Davis Vision contact lens collection, we will apply $120 towards the retail cost of the contacts and $60 towards the evaluation, fitting, and follow-up care fees after a $25 copay. In addition, you will get 15% discount on amounts in excess of the allowance for contact lenses and the evaluation, fitting, and follow-up fees. Please remember that out-of-pocket vision expenses such as vision exam copays and amounts over the frame or contact lens allowances can be paid with your Flextra benefits card through your Flextra spending account. If you enroll in Davis Vision Plan, you will receive an ID card. If additional ID cards are needed, you can contact our customer service department at 1-888-445-2290. Thank you for the privilege of presenting the Davis Vision Plan. We look forward to serving you.
Hello, I am Jeff Guidry with the Texas Legal Protection Plan. TLPP is a nonprofit organization created as an affiliate program of the State Bar of Texas in 1972. You know, at some point in your life, you most likely have had an issue that needed legal assistance. Examples of this range from reviewing contracts, property damage, divorce, creating a will, to adoption, credit issues, and identity theft. In those situations, you can choose to call a lawyer or handle the issue yourself. There are two questions that instantly arise, though. Can I afford to use an attorney? How do I find an attorney that is suited to handle my needs? With the Texas Legal Protection Plan, our members have the peace of mind knowing that they are always covered. You gain access to advice and consultation, a full online attorney finder at your fingertips, and coverage that ensures you have a blanket of protection throughout the entire state of Texas. And premiums are paid through payroll deduction. You may ask yourself, why is it important to have legal coverage if I don't currently have a legal need? Just like medical and automobile insurance, utilization of the benefits may not happen every day of the year. Utilizing TLPP's legal insurance allows you to proactively handle immediate items like estate planning and power of attorney, along with having the peace of mind that is there when you need it. What is covered under TLPP's insurance? Our benefits begin immediately on the effective date of coverage, with the exception of divorce, separation, and annulment, which has a 6-month waiting period. Each of the following benefits is available one time per year per family. Our action benefits include adoption court proceedings, bankruptcy court proceedings of a non-business nature, consumer protection, divorce, separation, and annulment, estate planning, including will, power of attorney, living will, and codicil, habeas corporate court proceedings, and name change. Our protection benefits include defense of civil action, defense of felony charge, defense of insanity or infirmity proceeding, defense of misdemeanor charge, defense of misdemeanor license suspension, defense of DWI, and juvenile court proceedings. TLPP offers additional 4 hours of preventative legal services per plan year. This includes legal advice, correspondence, negotiation, document preparation, and services outside the scope of TLPP's coverage can be utilized under this benefit. TLPP offers legal hotline with unlimited toll-free telephone usage of advice and consultation as well. Members of TLPP can choose from any participating attorney or choose to utilize a non-participating attorney. If you use an attorney who is not participating, coverage is available to you on an indemnity basis. You will be partially reimbursed for the cost of covered legal services up to a specified dollar amount. However, TLPP provides a wide range of participating attorneys throughout the entire state of Texas. Please note, the plan is not a license to sue. It cannot be used to take legal action against your employer for any reason. TLPP is 100% confidential with no copays and no deductibles. You may ask, so how do I use the plan? Accessing legal services through TLPP is easy. One way to access attorneys is to utilize the Attorney Finder within our new and improved website, www.tlpp.org. The TLPP Attorney Finder allows you to search for a participating attorney by name, zip code, county, and specialty. So why choose TLPP? TLPP can provide peace of mind coverage for all of your legal needs. The estate planning coverage alone pays for this service. With attorney rates averaging $200 to $300 an hour, you can't afford to be without coverage. We are providing you with information on enrollment in TLPP's insurance plan today, along with contact information for any questions you may have. We will provide you with the most comprehensive legal insurance available. We appreciate your time and look forward to working with you in the future.
Hello, my name is Will Cornforth, and it's my pleasure to be here today to give you an update on your deferred compensation program. I also wanted to take this opportunity to communicate some of the program's many benefits. Effective November 1, 2010, ING will be the new third-party administrator for the deferred compensation program. The transition from the current record keeper, Great West Retirement Services, to ING will happen automatically, but beginning November 1, 2010, you will access your plan a new way. After November 1, 2010, to access your account online, go to www.dcaustin.com. To make changes to your account by phone or to speak to a plan representative, you will need to call the toll-free plan information line at 1-877-66-AUSTIN. You will continue to have access to local representatives who can help you review your account and answer questions about the plan. The representatives will be me, Will Cornforth, and Mario Iniguez, and we will be located at 10900 Stone Lake Boulevard, Suite B150, and available by calling the plan information line. Please note, with the transition, there will be some fund changes and a period of time where account transactions will not be available. Important information regarding the transition will be mailed to all participants. Also, ING will be conducting transition meetings during the month of October. You can call 1-877-66-AUSTIN for meeting dates, times, and locations. All participants are welcome and encouraged to attend a transition meeting. Now, I'll discuss a few reminders about the plan. The contribution limits for your deferred compensation plan are currently the following. If you are under the age of 50, you can contribute up to $16,500. If you are age 50 or older, you are eligible to contribute an additional $5,500 for a total contribution of $22,000. You may also be eligible for the standard catch-up provision and contribute the annual limit up to $33,000. This provision allows you to contribute double the regular limit for up to 3 consecutive years when you are within 3 years of retirement eligibility using the city's criteria. If you aren't contributing to the deferred compensation plan, it's never too late to get started. You can start with a minimum contribution of just $10 or 1% of your salary per pay period, the equivalent of taking your lunch just 2 times a week. You can enroll online at www.dcaustin.com or by completing a form available from the local office or by calling the plan information line. You will need a personal identification number or PIN to enroll. If you do not have a PIN, you can obtain one by calling 1-877-66-AUSTIN. Now, let's take a few minutes to focus on the benefits of saving for retirement with the plan. The plan makes it easy to save for retirement with not only a low contribution amount and flexible contribution options, either a dollar amount or percentage of your pay, but participants also have access to their money through the loan program. Through this program, participants can take up to 2 loans and borrow up to half your current account balance and determine the payment schedule anywhere from 1 to 5 years for a general purpose loan and 5 to 30 years for a residential loan. Loan repayments plus the interest of the loan are deposited back into the plan account. There are additional fees of $50 for each loan, and fees are deducted directly from your account. In addition, participants can take money from their account at any age once they've separated service from the city without any penalty, an advantage other types of pre-tax retirement accounts such as 401k, 403b, or IRA don't offer. Participants only pay income tax on the money withdrawn that year. Through the plan, participants have access to a wide range of professionally managed investment options, including a self-directed brokerage account with access to hundreds of mutual funds. The ING Advisor Service is available to provide you with savings and investment advice designed to improve your retirement outlook. You have access to advice online or simply call the plan information line at any time to speak with an ING investment advisor. Your advisor can provide a retirement assessment and help you make best use of the services. If you prefer to have a team of investment professionals manage your account, ING also offers the Professional Account Manager program. Through the Managed Account service, our investment professionals design a personalized plan for you, rebalance your account, monitor your investments, make adjustments as needed, and keep you informed every step of the way. Ask your advisor about fees for this program. If you have money in a former employer's retirement plan or want to consolidate your retirement assets, you may also roll money from eligible plans into your deferred compensation plan. Contact a plan representative at 1-877-66-AUSTIN for more information to get started. We are committed to helping the city's employees save for a comfortable retirement. Feel free to contact a plan representative at 1-877-66-AUSTIN to schedule an individual consultation to enroll, review your account, or ask questions, or attend one of the many education meetings scheduled throughout the city. Thank you for your time, and we look forward to working with you in the future.
Hello, I'm Karen Espinoza, Benefits Specialist with the Employee Benefits Division, Human Resources Department. I will now go over the Dental Assistance Plan, life insurance coverage, and the short-term and long-term disability programs. Let's review the dental assistance plan. This plan offers coverage for preventive, basic, major, and orthodontia coverage. Preventive care, no deductible. Basic, major, and orthodontia has a $50 annual deductible. The calendar year maximum for the plan is $1,800. Orthodontia lifetime maximum is $1,800, and this amount is applied towards your calendar year maximum. This plan offers flexibility with no dental network. You can select any dentist that you choose. The plan design is a fixed fee reimbursement schedule, which is the maximum amount plan will pay for dental expenses. Let's look at an example of how the fixed fee reimbursement works. If your dentist charges $145 for a filling, the plan would reimburse $114.56. You would pay $30.44. If you have not met your annual $50 deductible, you would pay $80.44. Basic life insurance. Basic life insurance is paid by the city for employees scheduled to work 30 or more hours per week. The city provides basic life coverage in an amount of 1 times your base annual salary. If your annual salary is less than $20,000, you will receive the minimum of $20,000 of life coverage. Supplemental life insurance. Supplemental life insurance is additional life insurance you may purchase for yourself. Your cost for supplemental life insurance is based on your age, salary, and cost per 1,000 in coverage. To calculate your cost per pay period, go online at www.coaopenenrollment.com or refer to the Employee Benefits Guide. If you want to add or increase your supplemental life insurance, Open Enrollment is your opportunity to do so. You may increase by 1 coverage level, example, from 2 to 3 times your annual salary up to 4 times your annual salary. If you are a part-time employee working less than 30 hours per week, you must purchase basic life insurance to buy supplemental life insurance. Dependent life insurance. Dependent life insurance is insurance that you can purchase for your eligible dependents. Option 1, spouse, $10,000 in coverage for 60 cents a pay period. Children, 6 months to age 26, $5,000 in coverage for 10 cents a pay period. Children, 14 days to 6 months, $1,000 in coverage for 10 cents a pay period. Family coverage is $10,000 for your spouse, $5,000 for your children at 70 cents a pay period. Next, you have option 2. Spouse is $20,000 in coverage for $1.40. Children 6 months to age 26, $10,000 in coverage for 24 cents a pay period. Children 14 days to 6 months is $1,000 in coverage for 24 cents a pay period. Family coverage is $20,000 for your spouse, $10,000 for your children at $1.63 per pay period. You may increase to option 2 if you are currently enrolled in option 1. Short-term disability. Short-term disability is provided at no cost to employees scheduled to work 20 or more hours per week. You may apply for STD due to your own off-the-job injury, illness, or pregnancy. If approved, you will receive 70% of your base weekly salary. To be eligible, you must be out of work for at least 30 consecutive days. The benefit length is 60 days and is paid weekly. STD is considered taxable income. Long-term disability. Long-term disability is available for purchase for employees scheduled to work 20 or more hours per week. Your LTD cost is calculated based on your age, salary, and LTD rate per 100. To calculate your cost per pay period, go online at www.coaopenenrollment.com or refer to the Employee Benefits Guide. You may apply for LTD due to your own on or off-the-job injury, illness, or pregnancy. If approved, you will receive 60% of your base monthly salary. To be eligible, you must be out of work for at least 90 consecutive days. The benefit length is until your disability ends or until you reach age 65. LTD is not considered taxable income.
Hello, I'm Sherry Altus, Benefits Specialist with the Employee Benefits Division, Human Resources Department, and I will be covering the Flextra program. Flextra is a tax savings program offered by the City of Austin that increases the amount of money you take home each pay period. There are two parts of Flextra, the Flextra Health Care Account and the Flextra Dependent Care Account. On the Flextra Health Care Account, you reimburse yourself on a before-tax basis for eligible health care expenses. Here are some examples: copays, coinsurance, prescription copays, glasses, hearing aids, deductibles, vision materials, LASIK surgery, and over-the-counter drugs with a doctor's prescription. Examples of over-the-counter drugs are allergy medicines, cold medicines, throat lozenges, nasal sinus sprays, Visine, pain relievers, cough drops, sinus medicine, nicotine gum, or patches. However, these items are only reimbursable with a doctor's prescription, and you must pay out of pocket for these items and submit a Flextra Healthcare form to ERISA for reimbursement. On Flextra Healthcare, you estimate your healthcare expenses for the calendar year. The maximum you can set aside is $250 per pay period. You receive a Flextra benefits card to use when paying for eligible expenses. To estimate your Flextra Healthcare expenses, go online at www.coaopenenrollment.com or refer to the Employee Benefits Guide distributed to you with your coverage information statement. Under the Flextra section of the guide, you will find a worksheet and a step-by-step process to help you with your estimate. Flextra Healthcare non-reimbursable expenses are insurance premiums, expenses reimbursed by any other plan or policy, expenses for vitamins and cosmetics, or expenses for non-IRS dependents. You can only enroll in Flextra as a new employee, adding, dropping a dependent, status change, temporary to permanent, or during open enrollment. When you enroll in Flextra, you cannot stop participating during the year, and you cannot change your benefits unless you have an IRS permitted change. Both the Flextra Healthcare account and Dependent Care account are use it or lose it accounts. If you don't use the money, it will be lost. You have until March 15th of the following year in which you are enrolled to incur an expense. The deadline to submit claims for reimbursement is May 31st of the following year in which you are enrolled. The second program is the Flextra Dependent Care account. You reimburse yourself before taxes for eligible dependent care expenses. Eligible dependents are children under age 13, disabled dependents of any age, spending at least 7 hours a day in your home. Eligible providers are daycare providers who furnish a Social Security number or a licensed daycare provider. Non-eligible providers are relatives claimed as a dependent on your tax return or your spouse's tax return, or your child or stepchild under age 19. The maximum you can set aside is $208 per pay period. You estimate your dependent care expenses for the calendar year. You incur expenses and submit a dependent care claim form to ERISA. Checks are mailed weekly. To estimate dependent care expenses, go online at www.coaopenenrollment.com or refer to the Employee Benefits Guide.
You have just viewed video on demand for open enrollment. If you have any questions on anything you have heard, please contact us during normal business hours, Monday through Friday, between 7:30 a.m. and 5 o'clock p.m. at 974-3284. Thank you.